On behalf of the City of Springfield, I want to thank each and every one of you for being here. This is our 24th year celebrating Public Health Month in the City of Springfield. Now, if you look on the national website, it says Public Health Week. We in this city deserve more than a week, and so 24 years ago, we said we're going to celebrate public health all month long. We're going to ask an opening prayer be done by the Reverend Dr. Mark E. Flowers from Mount Calvary Baptist Church. Reverend Flowers.
No matter what your tradition is, let us just center ourselves. In my tradition, we bow our head, so I will bow my head. The greatest sovereign joy, peace that is embodied in this divine mosaic that you created and called to be in this place this morning. We welcome your presence. We welcome your joy. We welcome your help. We welcome your instruction. And more importantly, we welcome your healing. We remember in sacred text how there was a blind man from birth. You stepped in dirt, spat on it, rubbed it into the eye. You touched the infection, and you didn't mind getting dirty. So we bless you and we ask that you would impact us in such a way that all public health advocates, all those that serve as practitioners, and all of us who are the public, who need to be healthy, we ask that you would place people in our midst that will touch the infected parts, that will get their hands dirty, inspire us to be better, not just in this month, but in our life's journey. You are great, you are sovereign, you are divine, and you are healer, and you are real. And we thank you, and we need your love in this hour. Amen.
It is our divine birthright to live long, healthy, productive lives. This is the balance that you and I are seeking. This is the work that is done by public health advocates across this nation. And so on this day of celebration, we start with the youngest amongst us. This is the favorite part of the program for me. There are some young people who are here from the Holyoke, Chicopee, Springfield Head Start. They join us every year and have joined us for the last 15 years, I believe, and they come and they bring joy and they sing and they make all of us feel wonderful. And they also remind us that they are the reasons we do the work that we do. We want these young people to have that divine birthright of long, healthy, and productive lives. Welcome the young people from the Springfield, Chicopee, Holyoke Head Start. I always mess up the initials, but you all know what I'm talking about, right? Come on up.
we get ready to go to school in the morning. Okay, next one. Okay.
Let's give them a round of applause for that. Washing your face, brushing your teeth, washing your body, and what else did I miss?
And get ready to go to school.
And get ready to go to school.
Dress.
All right, thank you all. Give them a round of applause.
Over here. Follow Angel, okay? Okay, go ahead, Angel. Ready? One. Baby shark, do-do-do-do-do, baby shark, do-do-do-do-do, baby shark, do-do-do-do-do, baby shark. Mommy shark, do-do-do-do, mommy shark, do-do-do-do, mommy shark, do-do-do-do, mommy shark. Daddy shark, do-do-do-do, daddy shark, do-do-do-do, daddy shark, do-do-do-do, daddy shark. Grandma shark, do-do-do-do, grandma shark, do-do-do-do, grandma shark, do-do-do-do, grandma shark. Grandpa shark, do-do-do-do, grandpa shark, do-do-do-do, grandpa shark, do-do-do-do, grandpa shark. It's the end, do-do-do-do, it's the end, do-do-do-do, it's the end, do-do-do-do, it's the end.
These young people are from the Holyoke Chicopee Springfield Head Start, Madison Avenue, room 3A. Thank you. The next part of the program is the proclamation declaring Public Health Month in the city of Springfield. That will be done by Mr. William Baker, who is the Constituent Services Director for the city of Springfield. Mr. Baker.
Thank you. Good morning. Oh, we can do better. Good morning. There we go. First of all, let's give it up to those kids again from Head Start. They were awesome. Let's give a round of applause to our eloquent health commissioner, Helen Colton Harris. Every year she does this, does a fabulous job. So I'm here representing the mayor. Mayor Sarno would love to be here. He's usually here every year, but unfortunately he has a family matter he has to attend to. So he did me as the designated hitter, opening day. I thought that was a good term. So we do have a proclamation to read on behalf of the mayor declaring April Public Health Month. Whereas communities around the state have observed National Public Health Month each April to celebrate the role of public health prevention services to protect and improve our city's health. Over the past 24 years now, we have seen tremendous success by working together across the diverse fields of public health. And whereas we continue to stress prevention by teaching people how to promote their health and the health of their families, we strive to create a culture of health in our city that is committed to prevention. We continue to be supportive in our investments in proven community-based prevention programs to save lives and money. We respect each person as an individual without judgment, using every means possible to promote health and strengthening the families. And whereas public health is part of our everyday lives, from the water we drink to the air we breathe, the provisions of fresh, wholesome, and nutritious food, the safety of our parks and streets, to the laws that protect us from injury, and vaccines that help us stay healthy and alive. And whereas we wish to encourage public health workers to celebrate the gains made, to continue to aggressively create the change that make us a healthier community, we therefore wish to recognize the month of April 2019 as the 24th annual Springfield Public Health Month, with the theme being creating the healthiest city for science, for action, for health. Therefore, I, Dominic J. Sarno, Mayor of the City of Springfield, do hereby proclaim the month of April 2019 as Public Health Month in the great city of Springfield, and I strongly encourage every citizen to be aware and observe of this event and participate suitably in its observance by helping our families, friends, neighbors, co-workers, and leaders better understand the importance of public health. So signed by Dominic J. Sarno, Mayor of the City of Springfield. Thank you.
So, Mr. Baker, I am going to ask you to come back up in a few minutes to present proclamations to the individual who will receive the Commissioner's Award as well as the luminary. The Commissioner's Award is given to an individual who not necessarily his primary work is in public health, but has made perhaps over their lifetime or over their career a contribution to public health in our city. This individual has actually done more than that. She has taken the time to give back to the city of Springfield. She began her career as a nurse in the old Springfield Hospital, now Bay State. She went on to work at Wing Memorial Hospital, Bay State Visiting Nurses Association, Birch Manor Rehabilitation and Nursing Home, and Mercy Home Care, where she retired from in 2017. She has also blessed us by joining the City of Springfield Public Health Council. And we at the Public Health Council really value and appreciate the fact that she has been at every meeting. She has lended her voice to all of the very difficult decisions that we have had to make as a city. She is with us when we talked about syringe access, the biomass plant, and other really controversial issues we needed to deal with in order to make sure that the public health mantle was strong in the city. So we value and appreciate Mary Ann Baker. I know that I saw Mary Ann Baker here. There she is. Come on up. Come on. And so on behalf of the Public Health Council and the City of Springfield, for all of the work that you have done in moving public health forward in this city, we present you with the Commissioner's Award. Your name will adorn a plaque that we will have in the department. The mayor has given a proclamation, and I'm going to ask this young man, who I think is related to you, to give this proclamation on your behalf. Do you mind, Mr. Baker?
Congratulations.
Thank you. Thank you very much.
So on behalf of the mayor, we have another proclamation for you. Whereas Mary Ann Baker grew up in the Hungry Hill neighborhood of the city of Springfield. She is the oldest daughter of the late John and Anna Sullivan and the sister to Margaret Peggy Sullivan, also present, and the older brother to the late John Jack Sullivan. Mary Ann is a graduate of Cathedral High School and the Providence Hospital School of Nursing. And whereas she began her career as a nurse with the old Bay State Hospital, which Commissioner read, Mary Ann has volunteered her time in the community with numerous organizations and events. She has served on the City of Springfield's Public Health Council since 2015. In her spare time, she loves traveling and spending time with family and friends. Mary Ann is married to her husband, John, also in attendance, and they are the proud parents of a son, William Bill Baker. She is also the proud grandmother to two beautiful granddaughters, Gianna and Shailene. And whereas today we join with Mary Ann's family, friends, in acknowledging her years of dedicated and committed service to our community in the healthcare field, as she is recognized as an awardee during the city's 24th annual Public Health Month. Therefore, I, Dominic J. Sarno, Mayor of the City of Springfield, do hereby proclaim Monday, April 1st, 2019 as Mary Ann Baker Day in the great city of Springfield. And the mayor has a little comments. Hello to MacGyver, too. That's my father's nickname. So there you go.
Marianne, again, I want to thank you, and the Public Health Council unanimously wants to thank you for all that you've done for the city of Springfield. Best wishes and thank you.
Thank you very much.
Marianne Baker, you have flowers.
Thank you very much. Oh, they're beautiful. Oops.
Do
They
you,
are
do
beautiful.
you have them?
I got them.
Okay.
I got them. Thank you.
Okay. Moving on, our next award is the Luminary Award. The Luminary Award is the highest award that we give in the city of Springfield to any individual who has done work in public health. If you look at the back of your program, you will see all the names of the individuals that we have recognized in the past. Our first individual that was recognized was Dr. Jeffrey Scavron. That was back in 1997, which was some years ago. You'll see names like Mary Hicks Nicholson. Many of you remember the work that she did in the city of Springfield. This award is held in the highest of esteem, and anyone whose name adorns the back of this cover is truly a deserving individual and has put their time in advancing public health, not only in the city of Springfield, perhaps in the Commonwealth of Massachusetts, the Western region, perhaps even the world. I am going to ask any past luminaries that might be in the audience to stand. Mabel Sharif is standing. Dr. Frank Robinson is already standing. And so let's give those two individuals a round of applause. Going to ask one of our past luminaries and chair of the Luminary Committee, Ms. Mabel Sharif, to join me in doing this presentation.
Good morning. Oh, this is a very emotional time for me. I didn't realize it was going to be.
You okay?
Yes, I'll try. In 1968, Springfield was blessed to have this mover and shaker to join us in Springfield, Massachusetts. 1977 or 78, she accepted position of director of the YWCA PAGE program, which was the Pregnant Adolescent Girls Education Program. 1980, she received the calling which would influence thousands of our lives in Springfield and surroundings. She's none other than Miss Norma Baker. She's the former executive director of Northern Educational Service, which had so many programs, I'll probably leave some off. Substance abuse program, ESAS 3, the HIV counseling, testing, case management counseling, support groups for people with HIV, teen pregnancy and parenting program, and I can't think of the name of the program, but that was the housing for teen mothers. She had daycare, the Robert M. Hughes Charter School. Miss Baker influenced thousands of lives, including mine. And I tell everyone I went to the Norma Baker School of Human Service, and which is where I am, where that if people see me doing a lot of work today is because I worked for Northern Education Service in 1993. Ms. Baker was unanimously voted as the 2019 Public Health Luminary because she raised public health awareness in the city of Springfield. She advocated for public health program, inspired change in public health policy and change, especially, I would say especially, for her people, Black people who were underserved or none-served in the city of Springfield. Therefore, it is my pleasure, my honor, to present this award to Ms. Norma Baker. And the Luminary Award Committee present these flowers to you. Oh, no. Oh, so I knew we were giving you flowers, so.
Let me do this. Let me give you this plaque, which says the City of Springfield Department of Health and Human Services Public Health Luminary Award presented to Norma Baker, 2019. Ms. Baker certainly has influenced lives. She is an individual who believed in her own power, and she claimed that power and took that power and made significant change across the city. And we see it every day in individuals who are employed, individuals who might be underemployed. But what we know is that you took a chance on many folks that nobody else would take a chance on, and we see them in positions across the city. So I just want to thank you for the influence that you've had on me. I want to thank you for the influence that you've had on many women who look like me, who walk like me, who talk like me. It's all because there was somebody that we could look at and say, you know what, I can do this. And you helped us along the way. We thank you so much. Congratulations on being the Public Health Luminary.
Thank you. This is a great honor, and nobody talks like Helen Carlton. I don't know how many people know that Helen was working in Northampton, and I called her one day and I said, we need you in Springfield. I said, you can't be up there helping other people and don't come down here and help your own people. And she came. And she's been here ever since. So I just want to thank everyone. I would like those people who worked with me at NES at any time to please stand. Anybody, just stand up. Again, I want to thank you for the award, and nobody does anything by themselves. They have to have good people that work with them and work for them and who are willing to work for the community. So thank you again. Let me just thank my family who put up with me all these years when I was trying to save everybody else. Oh, okay. Okay.
Here he is, over here.
I'll turn this around. Thank you.
Thank you. We do have another proclamation from the mayor. Mr. William Baker, will you please come and read the proclamation for Miss Norma Baker?
And let's hear it for the Baker ladies. Another proclamation from the mayor, this time recognizing Miss Norma Baker. Whereas Norma Baker holds an associate's degree from Springfield Technical Community College. In 1977, she graduated from the UMass Graduate School of Education. Norma has worked for the Department of Mental Health and served as director of the WYCA's Pregnant Adolescent Girls Educational Program. She went on to be one of the founders of the Robert M. Hughes Academy School and served as the executive director for the Northern Education Services. And whereas under Norma's leadership, Northern Education Services initiated the first HIV and AIDS prevention education services in all of Western Mass. Subsequently, Northern Education Services became the premier HIV and AIDS provider for African Americans in Western Mass. In 1991, Norma partnered with the Martin Luther King Jr. Family Services to develop Families Care in Nutrients. Is that the program? Nurturance. Families Can, which provides social workers to families in distress from multiple sources. And whereas today we join with Norma's family and many friends in acknowledging her years of dedicated and committed service to our community and the healthcare field, as she is recognized as an awardee during the city's 24th annual Public Health Month. Therefore, I, Dominic J. Sarno, Mayor of the City of Springfield, do hereby proclaim Monday, April 1st, 2019, as Norma Baker Day in the City of Springfield. And I strongly encourage every resident to be aware of this event and participate suitably in its observance and acknowledgement of the honoree. So signed, Dominic J. Sarno, Mayor, and he leaves a little note, God bless.
So I'd like you to take out your green insert and I just want to make sure you read this because I think it's important. Join Generation Public Health and take the pledge to help create a healthier Springfield. We are a growing movement of people, organizations, communities, collaborating across sectors to create the healthiest city in one generation. We believe that everyone deserves the opportunity for a long and healthy life. We promise to support efforts to improve the social and environmental factors that affect everyone's health and limit the ability for many people to make healthy choices. It is only when we come together that we are strong enough to create the healthiest city in one generation. We are Generation Public Health, and we're going to hear about Generation Public Health in a few minutes, but let me say to you, all of you know this, we can still look at the data and tell that marginalized, underrepresented communities still show up disproportionately in every health status indice that we look at. And that is not okay. It's not okay that individuals, because healthcare should not be determined by who has power over whom. Healthcare should be something that each one of us has access to, and public health, in particular, the science of prevention and intervention, also is something that we continue to move forward. So once again, I thank those individuals in this room who understand that we need to move the needle in the city of Springfield. I want to thank, Ms. Baker alluded to the fact that you don't do anything by yourself, and I certainly did nothing by myself ever. And so I want to thank an amazing staff, and I would ask the staff of the city of Springfield who are here, please stand so we may celebrate you. Thank you, and thank you all for the amazing work that you do every day. Our next part of the program is another reason we stand here together in order to celebrate Public Health Month. I am so amazingly proud of these young people. They, as you may recall, are a big part of the reason we were able to pass the tobacco ordinance that said that you had to be 21 and over to purchase tobacco products. These individuals went to the State House. They were every place in the city of Springfield, working with our city council, knocking on doors. They are amazing young people, and when I look at them and listen to them, what I know is public health is safe in the next generation because they are a generation of young people who really believe. Each year we have a keynote address, and we ask someone to come before us and give us some information that we can use to move through the month. And this year we have 5 amazing young people who are going to do a presentation for us. They are the young people from the Martin Luther King Jr. Family Services Peer Health Advocate Program. I'm going to ask as they come if they would introduce themselves to you. Say your name, maybe what school you go to, and anything else you'd like to do to introduce yourself.
My name is Taylor Warren, and I go to Central High School, Springfield Central.
My name is Maxwell Maddox, and I attend Renaissance High School.
My name is Chantal Nortes, and I go to Springfield Honors Academy.
My name is Jacob Ojito, and I attend Putnam Academy.
My name is Liz Rivera, and I too attend Putnam Academy. So, good morning. My name is Liz Rivera, and I'm here with my peer health advocates from the Martin Luther King Jr. Family Services. We are honored to be here and address you during Springfield's Public Health Month kickoff. I speak for the group when I say that we wouldn't have been able to do the things that we've accomplished if it wasn't for community partnerships and team building. Being a part of this group has taught me the importance of public health, social justice, community engagement, and advocacy. Through science, health, and action, we successfully advocated for policies impacting youth health, state and local level. It is up to us, everyone, to make Springfield the healthiest community for all. We want to educate our friends, family, and neighbors so they too can advocate for the changes they want to see in our communities. Today, my peers will share what has inspired us to actively participate in improving health outcomes and learning more about public health. Chronic diseases like lung cancer, diabetes, hypertension, asthma, and cancer disproportionately affect our residents. Part of my job is attending group sessions where every Thursday, my coworkers and I learn about how to use tobacco, unhealthy eating, and lack of physical activity contributes to most of these problems. I myself use this information given to me and pass it on to my classmates and loved ones. I inform them on the harm that they're doing to themselves when they do an action like smoking or don't do an action like healthy eating. This to me is one of those accomplishments that we make while being advocates. I live in an area where everywhere you turn, there's smoking and drug use. It's something that I can't escape, but thankfully I myself haven't been dragged into it. So I share this knowledge and encourage others to do the same. We hope to inspire our community and take part in making Springfield the healthiest city.
Did you know that cigarette smoking is responsible for more than 480,000 deaths per year in the United States? And tobacco companies spend $9.5 billion per year advertising, targeting youth and low-income communities. Vaping and e-cigarette use is rising among youth across the nation, and it is affecting our communities. It's clear that people's health, lifespan, and well-being are connected to their communities, the places where we live, learn, work, worship, and play. Community Connections is a program where we sit down to have dinner with physicians and to our hospital departments. Through these conversations, we learned about the effects that tobacco has on our body and how it affects the health of the overall community. The doctors were able to show us exactly what tobacco does to your lungs by showing us removed organs that have been affected by the usage of tobacco. Learning about the negative effects of tobacco was discomforting. Due to the loss of function, surgeons may have to extract major organs from patients. This affects the patient's quality of life, and they will have to adapt and adopt to a new lifestyle. At another Community Connections dinner, we met with doctors in the addiction and recovery field to learn how opioid use affects the brain and can cause someone to be addicted. It was great getting to know that these doctors treat these people as humans going through a rough time in their lives, opposed to the general stigmatizing that we hear about. Addiction is a brain disease and should be treated as other chronic health conditions. Providing opportunities for restorative care, like access to detox, treatment, and recovery, are just as important as access to physical activity and healthy foods. I attend Putnam Academy, which is a vocational school here in Springfield. My shop is Business Information Management, also known as BIM. The goal of the shop is to make our students employable to today's career fields. Our shop class is very community-oriented. We have worked closely with the City of Springfield's Health and Human Services Substance Use Department, participating in student surveys and focus groups about our views on drugs and substance misuse amongst our peers. We discovered our perception of the problem was different than the reality. This motivated us to challenge our friends to don't believe the hype that music and social media promote about sex, drugs, and violence. We hosted Teen Sober Night Outs and took the Operation Prevention Video Challenge. Sponsored by the Drug Enforcement Agency and Discovery Education, this challenge was to create a 30 to 60 second public service announcement video that sends a message to our peers about the harms associated with misusing prescription opioids. Learning about science has taught us why we should invest in prevention education and promote behaviors such as healthy eating and physical activity. This also involves supporting youth to graduate from high school because high school graduates tend to lead longer and healthier lives.
It is our job to defend the critical role of strong public health systems in creating healthier communities and urge decision makers to make health a priority in all policymaking. Early research shows that living in a more walkable community does indeed encourage more physical activity among residents. Let your policymakers know that you support community planning, transportation, and public health safety efforts that make it easier for all people to choose walking, biking, and public transit. One of our group sessions involved being educated on what complete streets are and how this can affect a community's overall health. Expanding safe biking and walking opportunities and working with environmental justice groups help us keep in mind particularly vulnerable residents. Making drivers share the road makes it safer for pedestrians to reach their destinations. This small action will encourage people to walk and bike more consistently. I learned health equity means to ensure everyone gets what they need. Providing access to physical activity and maintaining sidewalks can promote healthy behaviors. Bike lanes make for safe biking networks and can lead to more cycling and fewer injuries among bicyclists. I have a friend who was hit by a car while biking. As the red light was shown and the walk sign was seen, he proceeded to bike across the street. A car had came into contact with his bike between the time he started to cross and the time it would have taken him to get to the other side. He was severely hurt but could have been at risk for a death that could have been prevented. Rates of preventable deaths, such as deaths from heart disease, diabetes, and cancer, typically go down in communities where local public health spending goes up. As an advocate for safer and better Springfield, it is my duty to make sure all of Springfield is a safer place, including safer streets for drivers, bikers, and pedestrians.
Smart local policies that prioritize health can make a difference. You can help by taking action and speaking up upon behalf of policy efforts that make it easier for everyone to access nutritious food, or support prevention education for tobacco, alcohol, and other drugs. When my team and I put what we learned about health and science together, we were ready to take action. This allowed us to successfully influence policy at the local and state level. By advocating for the increase of the person's age of tobacco products, we would help limit youth access. Less access means more opportunity for healthy behaviors. To better understand the community's view of tobacco use, we conducted a perception survey. We researched the effects that tobacco and e-cigs have on the body to share during outreach in order to bring awareness to the health problems associated with tobacco use. We also learned so much from connecting with residents of Springfield, a variety of fun family events that were hosted in the city. To show their support, we collected over 200 postcards and resident addresses to present at the public committee meetings during the public hearings. We were invited to WTCC, Health Matters Radio, to talk about our advocacy work and join youth across Massachusetts at the State House to rally against big tobacco. We knew this law was not only important to the health right now, but to future generations. I have seen so many of my peers get hooked on e-cigarettes in the past year. Most were friends I grew up with. It's disheartening to see most of the friends I grew up with get hooked on e-cigarettes and have later health conditions that can be life-threatening.
As you can see, through science, health, and action, we have inspired to make Springfield the healthiest city. And working with this team for almost a year, we've made remarkable discoveries will open the eyes of many. We were able to learn from a plethora of extraordinary people, such as those dealing with substance misuse disorder, physicians, law enforcement, local officials, and believe it or not, have been inspired by the words of kids at summer camp. Some attending public events, learning about people's perception on tobacco use, to understanding how complete streets improve the rates of chronic illness. We will continue to advocate for healthier community. With the knowledge I possess, I wish to positively influence our peers. Recently, I had attended an event at Springfield's Community Music School where the Improbable Players put on a play showing examples of how families can break down due to all forms of substance abuse. This play has shown me that every day that people that look like you and I can fall victim to substance abuse. On a spectrum of substance misuse, every day can turn into an addiction. Research has shown that smoking is one of the leading causes of death. Tobacco companies are targeting Black communities by using well-known public figures as the face of their products to make them seem more popular. They advertise things like e-cigs and vapes are safer products, but we all know the truth. You'll surely have side effects. The substances inside this drug hasn't even been regulated by the FDA. 13.6% of what is put in these tobacco-based products aren't even known. We have received a mini grant to advocate for local policies that would limit the sale of flavored tobacco products to adult-only retailers and restrict the sale on tobacco products near schools. Using Photo Voice, we will go around the community and take pictures to show how tobacco retailers have not only targeted the youth, but the Black community as a whole. Majority of our corner stores, bodegas, and places that sell these death-induced devices and drugs are within 500 feet of our schools. Think about your loved ones or someone you know whose child or children are exposed to these on a daily basis. These products are potentially one of the deadliest weapons to the human body. During a Youth Power Summit, we did a timeline to show that tobacco has been advertising products to the Black community since the abolishment of slavery. The timeline has shown us that the first crash crop was tobacco. When slavery was abolished, it became more popular among this community. At this point, this drug has been around us for so long that over time we were influenced to use it. During one of the Community Connections dinners, I learned that this drug is hard to bounce back from. A cardiothoracic surgeon told us that you must live a healthy life to live with one lung. And they can tell their patients are struggling because the appointment rooms are elevated. And they have a hard time breathing once they get to the top. This proves whether or not the surgery will take a toll on them. The doctors at Mercy also told us the lungs of a person is almost like a sponge. Small air-like holes will allow air to pass through in and out the body. When a person smokes, those holes get bigger over time, and when exhaling becomes difficult because air is not contained. You or someone you love could have a problem completing daily activities of living. Concerned yet? If not, think about these critical points that need more examination by our everyday people. This is affecting not only our today's youth, but our future. Does that not change the way you see this epidemic? The science behind what makes us healthy is clear. It is up to us, everyone, to take action in supporting public health initiatives to promote healthy behaviors. Let decision makers know what you want and need in this community and actively participate in making it happen. All right. Now I would like you to refer the green paper inside your agenda for today and take the pledge in making Springfield a healthier city with us. The healthiest city with us. May we all stand? We are growing a movement of people. Together, yeah. In unison, please. I won. All right. We are a growing movement of people, organizations and communities collaborating across sectors to create the healthiest nation of one generation. We believe that everyone deserves the opportunity for a long, healthy life. We promise to support effects into social and environmental factors that limiting the ability for many people to make healthy choices. It is only one, and we are strong enough to create the healthiest city in one generation. We are Generation Public Health.
Thank you. I'm going to ask them to stay here, but let's give these young people a round of applause. Thank you. I am a person who believes strongly in the passing of a baton, and that there was someone out in front of me, a Norma Baker, and others who had a baton in their hand, and they passed it off and said, "This is your leg of the race. Run it well." I say to you about these young people in back of me that this is their leg of the race coming up. We encourage them to run it well. We encourage them to run it strong. We encourage them to have a strong baton to pass off. And that is what we want to do for them. We want to support these young people in everything that they do. And so let us all together take that pledge. Thank you, young folks. Appreciate it. I want to acknowledge Amani Harris. Where are you, Amani? Amani has, yes. Amani now works for the Department of Health and Human Services, but she mentored these young people for a number of years. And like Norma Baker, I knew a good thing when I saw it. And so you gotta come work at the department. I've always wanted that. And you can see why. She has taken her time, her attention, her treasure, and worked with these young people. Even right before we came here, she was out in the hall with them, making sure that everyone was ready. So Amani, thank you so much for your work with these young people. Is there a current peer individual that's working with you? Is there some? Come. Yes. You are still working at the Martin Luther King Center, right? How long have you been there?
6 months.
6 months. So I'll wait another 6 months before I come and steal you too.
Thank you.
But say your name.
My name's Ariana Williams.
Ariana Williams is the individual who is now working with these young people, and I can tell that you're doing an amazing job as well.
Thank you.
Thank you so much for being here.
Thank you.
Yeah. I want to recognize the Public Health Planning Committee. You all know that this does not happen without the work of a lot of individuals. First of all, let me recognize my Deputy Commissioner, Solo Adenis. Solo, where are you? Thank you, Solo, for representing on behalf of the department. Solo was a local public health planner for the Commonwealth of Massachusetts, another person we just come on over. And so he's with us. And so thank you very much, Solo, for your leadership from the department. So the Public Health Committee, would you stand so I can recognize you, please? Barbara Gresham, Ann Brantley, Brenda Evans, Chris Mary Gonzalez, Alma Stelzer, Lorene Limbring. You know, Lorene, I've been working with you for 25, 30 years, and I still mess up that. Sister Lorene. Amani Harris, I introduce Ann Mistovar. Ann, thank you. Is there anyone else who was on the committee who I did not recognize? Okay, give them a round of applause. Thank you. Did I recognize you? Well, see, you gotta, like, you didn't recognize me, okay? Okay. I know Chanel. Ford, okay, well, okay, Chanel. You could have gotten married on me, you know, that happens sometimes, folks, just move on. But Chanel, thank you. Chanel worked with us at the department as well, correct? Thank you so much, appreciate you. Is there anyone else that I did not recognize? Yell out. Okay, it seems like we are good. Want to recognize those individuals who gave us raffle gifts: Health New England, Walmart, AC Produce, Eastfield Mall, Springfield Family Resource Center, WIC, Caring Health Center, Enhancement Creations by Teresa. Okay, and so we are going to give these young people some recognition from the department, a certificate, Your Voice Matters certificate. It says this certificate is hereby presented with your name for your participation in Public Health 2019 kickoff event, City of Springfield, Department of Health and Human Services. It's signed by Dominic J. Sarno, Mayor, and myself. So each one of you, you're going to get one of the certificates. Would you come forward, Jacob? Maxwell. Chantel. Thank you. Liz. And Taylor. Thank you. There are also some books, resource books over here for you as well, and we'll make sure that you get those, okay? Again, you were magnificent as always. Thank you.